Hello guys, how are you? I hope you are doing fine. In this video, I will be discussing a very important branch, which is medication counseling. Medication counseling. What do I mean by medication counseling? By medication counseling, I mean that it's a station where you have been asked to explain to the patient about a medication that she is going home with. Okay, so again, medication counseling is a station where I will be discussing about a medication that the patient is going with to his house, to his home. He's getting discharged with this medication, and your job is to explain, is to counsel the patient about the medication. Okay, in this session also, I will be discussing some other medication which we consider as medication counseling, but it is an emergency contraception as well as the methods of contraception. So I will be discussing in this station about medication counseling. So is there a structure for medication counseling? Yes. All the stations that I will be talking about, before you finish your scenario, make sure you have mentioned or you have spoken about the medication, which basically has been mentioned in that question. So what is that I need to mention about the medication? Okay, I need to talk about the form, the dose, mechanism of action. And when I say mechanism of action, you are talking to a patient. You are not talking to a doctor. You are not talking to a pharmacologist. When I say mechanism of action, I mean by that, how does it work? That's when I say the mechanism of action. Then I will be talking about the side effects of these medications, and finally, or before the last, I will be talking about contraindications of this medication. Contraindications, which is situations which will prevent me from using this medication, or which will prevent me from prescribing the medication. Contraindication. And finally, what to watch out for. And when I say what to watch out for, by that I mean safety netting. Again, any medication counseling station, the purpose of this station is talking about a medication, describing a medication to one of the patients. And this medication, as I mentioned to you, before you leave the cubicle, you need to know that the purpose of this station is to explain to the patient about the medication. Form, is it tablet, is it suppository, is it IV, IM, dose. How does it work? How to prevent, how does it work? Side effects, what is the side effect of this medication? Contraindications of these medications, and finally what to watch out for. And when I say what to watch out for, which means safety netting. So that's it, Dr. Mo. Yes, that's the purpose of the station. However, before you start talking about the medication, there is an approach that you will use to approach the patient. What do you mean? If a patient is admitted in the hospital, for example, and your consultant asked you to go and prescribe this medication for him, the approach I can see from my note that you've been admitted here with us, hospital stay, how's the care by doctors and nurses. I can see that you had a heart attack. Do you know what heart attack is? Has anyone explained to you about heart attack? Things like this. So basically, before I start talking about the medication, I will take short, brief history about the patient condition. I will assess the patient understanding about his condition, and I will make sure that the patient understand about the condition, and then I will start the station by my consultant has asked me to come and explain to you about your medication. Then I will use this point, which are medication counseling stations. Let's now take one by one, and when we discuss the stations, one thing I want you to know is before you leave the cubicle, you must use this structure. So the first station is talking about statin. So write down the question. 70 years old, Tanya. Her BMI is 28. Her blood pressure is 160/90. Her cholesterol is 6.9. So BMI 28, blood pressure 160/90, cholesterol 6.9. Other blood tests were normal. So all the blood tests were normal apart from cholesterol high, 6.9. The patient BMI is high, blood pressure is high. Be careful because these are the findings in the station. You need to use it. Blood pressure high, BMI is quite high, cholesterol is high, everything else is normal. Her Q risk is 17, which is high. Q risk. She is due to be started on statin. Your consultant has asked you to go and talk to her and explain to her about her medication. So now in this station, your consultant asked you to go and explain to her about the medication. So before you finish the cubicle, before you finish the station, you need to talk about the statin, form, dose, how does it work, side effect, contraindication, what to watch out for. Yes, doctor. However, how to start the station, what is the approach of this station is basically blood result station. The patient is coming because she had some blood tests which were all normal apart from cholesterol, which she will talk about. So you will explain to her about cholesterol, the source of cholesterol, and what can cholesterol lead to. You will explain to her about Q risk. So basically highlight what's in the question. In the question it's written cholesterol, highlight it, Q risk, highlight it, blood pressure, highlight it, BMI, highlight it. So 4 things that I will be talking about, and then I will move on to explain about the medication. And for you to talk about the statin, you must relate it to the patient condition. So you will basically talk to the patient about the fact that the cholesterol is high and what can this high cholesterol lead to, the risks of having high cholesterol. That's why we're going to give you the medication, then talk about the medication. This is how you approach that station. So, hi, I'm Dr. Fatih Al-Bab, one of your doctors here. Can you please confirm your full name and date of birth? Full name this, date of birth this. I can see from my notes that you are coming today for your blood tests results. Yes, doctor. Would you like me to explain the result first, or is it okay if you have a chat? Well, doctor, whatever. Then you will start talking to her about the chat. What made you come for this blood result from the first place? She will tell you, doctor, I just came for a routine checkup. Now, you will start asking her a few questions. What are the questions about? They are all related to high cholesterol, high blood pressure, and BMI high, which is any headaches, blurred vision, chest pain, shortness of breath. So these are because of high blood pressure. Okay? Any weakness anywhere in your body. So all these questions I'm asking is to exclude the consequences of having high cholesterol and the high blood pressure and BMI, which is MI, stroke, mini stroke. So any chest pain, shortness of breath, any headaches, blurred vision because blood pressure is high, any weakness anywhere in your body? No, doctor. She doesn't have any of this. Okay, well, we've had here some blood results. All of them are normal apart from the cholesterol, which is high. And also we've examined you and we found that the blood pressure is high and the BMI is high. Okay, do you know what BMI is? Yes, doctor. If she doesn't know, tell her it's the weight against the height. Okay, and here it's 28, which means it's quite high. Okay, also your blood pressure is quite on the higher side, which many reasons why you can have high blood pressure. One of them is the fact that you have high cholesterol. Okay, do you know what cholesterol is? Tell her about cholesterol. Cholesterol is what we call it the bad fat in the body. This is the bad fats in our body. Well, usually it is important for us to have some some little amount of this bad fat in order for the body function to be normal. However, if it increases, it can lead to some consequences, like it can accumulate in the blood vessels, leading to decrease of the blood supply that's going to the brain. It can cause strokes, or the heart when it causes heart attack. Guys, but obviously that will be slowly. But I'm telling you the content of how the scenario will go. So you are telling her now about cholesterol. You've told her about the finding, everything is normal. You've told her about the blood pressure high, and now we also found that the Q risk is 17. Do you know what Q risk is? No, doctor. Q risk is a prediction of having a problem that is to do with your heart and your blood vessels, which we call it a prediction of having a cardiovascular problem. Usually Q risk, if it's more than 10, that means that there is 10% chance of having cardiovascular problem. Oh, really? Yes. For that, we would like to give you something that will decrease the cholesterol level. Oh, really? Yes. However, would you like me to tell you about the sources of cholesterol in our body? Yes, doctor. Well, cholesterol have two sources. Either we get it in diet, yes, or it's secreted by the liver. So, we'll be giving you some medications that will basically decrease the excretion of fat from the liver. However, things that you should do, which is lifestyle. So can you walk me through your diet? Why, guys? The source of cholesterol is either liver or diet. So if you give her medication that work on the liver, but she still eats, then the cholesterol will still increase. So you need to control both of them. That's why you need to explain to her that the source of cholesterol could be diet, could be the liver. So we will give you something that will act on the liver. However, we will need to have a chat about your lifestyle, then ask her about diet, exercise, smoking, alcohol, and then with that we can prevent, or we can decrease the cholesterol level, and that will decrease the chance of you having problem or cardiovascular problem or heart problem that affect the heart and the blood vessels. Okay, that's how we're gonna approach the station. Then you will start talking about the statin. So again, in this station, I have highlighted in the question BMI high, blood pressure high, cholesterol high, and also we have highlighted the word the Q risk. 4 words. Okay, the purpose of the station, guys, is because you know that the cholesterol is high, the blood pressure is high, and the BMI is high. The approach is, I can see from my note that you are coming for the blood result. Yes, doctor. Test result station. Would you like me to explain the result, or should we have a chat? Whatever, doctor. Then start having the chat. What made you come for this test result from the first place? The patient will tell you, doctor, everything was fine. So start asking a question relevant to do with what? What relevant to do with the cholesterol, the blood pressure, the BMI. So any headaches, blurred vision, chest pain, shortness of breath, any weakness anywhere in your body. So now you are excluding the consequences, the things that high cholesterol can lead to. No, doctor. Then start talking to her about the result, blood result. Well, we've done some blood results. Everything goes normal apart from the cholesterol, which is quite on the higher side. Okay. Also, the blood pressure is quite high, and the BMI, which is the body mass index. Have you heard about it? Yes, doctor. No, doctor. If no, explain. It's quite high. Would you like me to explain to you about the cholesterol? Yes, the cholesterol is what we call it the bad fat. Okay. The source of cholesterol, this is like an entry to the station. The source of cholesterol is the liver as well as the diet. So, few things that we can do in order to prevent this cholesterol from getting in higher levels, which is things that I will do, things that you will do. Things that I will do, I'll be giving you some medications. Things that you will do, that the lifestyle modifications. Is it okay if we have a chat, ask about diet, exercise, smoking, alcohol, because it's a reason why the patient can have high cholesterol. So if you give the patient tablet, but the patient is still having bad diet, the cholesterol is still going high. Then you are telling her now what cholesterol is and If the cholesterol is high, it can lead to problems like heart attacks, like strokes and many strokes. That's why I would like to work on it. So now we'll start discussing with the patient about the Q risk, which is the prediction, the expectation of you having a problem that affects your blood vessels and your heart, which is quite high because it's more than 10, which means that there is more than 10% chance of you having problem in the future. So is it okay if you have a chat about the medication? Then start talking about the medication. But now she knows that this medication is important to decrease cholesterol. If I don't have it, the cholesterol will increase. The cholesterol can lead to stroke, many stroke, heart attack. So the reason why I'm approaching the station that way is because the patient needs to know. Because if the patient doesn't know about cholesterol and the consequences of having high cholesterol, etc., if the patient doesn't know, there will not be compliance. You are telling her for her to be compliant with the medication. Okay. Now I will start talking about the cholesterol, the medication. So I'll tell her this medication is in the form of tablets. So it's tablets. You will take it through your mouth with water. Okay. It's a tablet a day. So you will be taking 1 tablet a day. This is the dose. 1 tablet a day for the rest of your life. Dose. Would you like me to tell you how this tablet works? Yes, doctor. This tablet works by preventing the secretion of the fat from the liver. So if you think about it, it works on the liver. Yes, doctor. Like any medications, it has some side effects. I'd like you to know about them. Number one, it can cause liver damage because it acts on the liver, okay? Number 2, it can lead to some muscle pain and kidney problem. So with the statin, remember 2 words. Remember liver, in fact 3, liver, muscle, pregnancy. Liver and muscle and the pregnancy. So liver, it works on the liver, so it can lead to liver damage. Okay, side effect. Muscles, it can lead to muscle pain. Okay, and you can come to contraindication. So with contraindication, you will say to her, okay, like any medication, there are some situations where we don't give the tablet. For example, if you are pregnant, and then guys, if she's in a childbearing age like 25 to 30, 32, 35, please make sure you ask about pregnancy, because contraindication is pregnancy and contraindication if she has liver problem. So pregnancy, liver and kidney problem. So you must tell her that there are some situations where we don't give the tablet, which is the fact if you are pregnant and liver and kidney problem. Okay, so contraindication. So what to watch out for? At any time you have muscle pain, you have tummy pain, come right away. And because this medication works on the liver and contraindication liver damage, tell her we will be monitoring your liver function test at 1, 3, 6 and 12 months. So 1, 3, 6 and 12 months, the liver function test will be done to monitor the liver function. So if you tell me Dr. Mo, and by the way, statin will be taken in the evening. So if you tell me Dr. Mo, when I see the word statin, what do I need to remember? Remember, liver, muscle, pregnancy. I will write them down here. Liver, muscles, pregnancy. What do you mean, Dr. Mo, by liver, muscles, pregnancy? This medication is contraindicated if the patient is pregnant and if the patient is having liver problem. This medication side effect, liver damage and muscle pain. And that's why we monitor the liver function test 1, 3, 6, 9, 12 months. We do liver function test because the liver function needs to be monitored. Okay? So that's the station about statin, and that's the structure and the approach. The second station is about warfarin. 40 years old Alicia was admitted to the hospital for a week. Why? Because she had DVT. She had DVT, deep vein thrombosis. Yeah, it was managed. Now she's going home. The consultant asked you to prescribe her some warfarin because she will go home in warfarin. In brackets, The patient has learning difficulty. The patient has learning difficulties. Guys, whenever they give you any station and they tell you the patient is having a learning difficulty, it means that you are dealing with a patient who is not really smart. It means that you are dealing with a patient who doesn't understand easy, who doesn't understand well. So what to do? Be slow. That's it. When you talk, always check understanding. Always check understanding. Are you following me? Is there anything you'd like me to explain? Should we move further? Is everything okay so far? That's the main thing. So always slow, check understanding, always assess knowledge, always check that the patient understands well. In this kind of stations, if they tell you learning difficulty, any station can be learning difficulty station. Any scenario in PLAB 2, they can tell you that the patient has learning difficulty. Why? To check, are you able to talk slowly? Are you able to assess the patient understanding? So the purpose of this station is not how much you said, it's all about does the patient understand or not. So this station is a typical station, same approach. The patient is being admitted, she's going home on warfarin. The patient is being admitted, she's going home on warfarin. One thing I want you to know, warfarin is a blood thinner. Blood thinner. The blood will be thin. The blood will be thin. So make sure you know that the patient does not have any risk of fall, because if he has a fall, she has a fall, she'll have brain damage because of bleeding. Make sure that the patient doesn't go near any objects, like sharp object, she will have bleeding. So make sure the blood is thin, so the patient will need, when you go to the dentist, they will inform them because of bleeding. So again, make sure the patient doesn't have high blood pressure, because high blood pressure with blood that is thin can lead to rupture of blood vessels. So high blood pressure. Make sure that this patient doesn't have any bleeding source, peptic ulcer for example. Peptic ulcer. Make sure the patient is not pregnant, because again, that's all situations with warfarin. So I will start the station by building rapport. Hi, I'm Dr. Fatih Al-Bab, one of the doctors here. Can you please confirm your full name and date of birth? Yes, doctor. I can see from my note that you are going home. Yes, doctor. How do you feel? How do you feel? I also saw that you came to the hospital, you were admitted because of pain in your leg. Don't use DVT. Don't use DVT. Yes, doctor. Yes. How do you feel now? Do you still have pain? No, doctor. Well, my consultant asked me to give you a medication, which is a blood thinning medication that will make your blood thin. Because we don't want you to have a thick blood, because thick blood can lead to health issues, can lead to problems. Why am I doing that? Because it's learning difficulty. I'm talking slowly. Yes, doctor. So always use the word thin blood, thick blood. Don't use DVT. Use pain in the leg, pain in the chest, breathing problem, shortness of breath. Anyway, so my consultant asked me to prescribe for you some medication that will make your blood thin. Is that all right? Yes, doctor. Yes, doctor. So now you will start talking to the patient about the warfarin. Now you will start talking to the patient about the warfarin. So you will be given a medication which is in the form of tablet. So you will take it with water. So be careful, guys, because the approach, the start, before I started talking about the medication, was basically rapport. I can see from my note that you've been admitted. How was the hospital stay? How was the care by doctors and nurses? Number 2, she was admitted with DVT. Do you still have pain in your leg? Do you still have pain in your leg? No, doctor. And then start asking about any pain anywhere, chest pain, shortness of breath. Why? To exclude any clots. Then I said my consultant asked me to prescribe for you some medication, which is warfarin. Is it okay to talk about it? Yes, doctor. And don't forget that again in the start, in the approach, I said you had this problem because your blood was thick, and you would like to make sure that your blood is thin. That's it, thick and thin. Now you will start talking about warfarin. It is in the form of tablets. You will take it daily, better in the evening, exactly like statin. How does it work? Would you like me to tell you how does it work? Yes, it works by making your blood thin. By making your blood thin. So always make sure you use the word thin and thick, yeah? Like any medication, it has some side effects. Would you like me to tell you about it? Yes, the side effect is bleeding, guys. Guys, the side effect is bleeding. Bleeding. So the side effect in one word, bleeding. It will increase the risk of you having bleeding issues. However, we will try to monitor your blood through some blood tests. Don't say blood investigations. Through some blood tests. Don't mention the word INR, but the examiner knows that you're talking about INR, blood tests. Okay. Now, like any medication, there are situations where we don't give the medication to the patient. Guys, whenever you talk about contraindication, in brackets write history. In brackets write history taking. What do you mean, Dr. Mo? Whenever you reach the word contraindications, it means that you need to know, is this medication contraindicated or not? Which means that you need to take some history. History about what? About everything in the world? No. History about the contraindication for this medication. So, then you will say, like any medication, there are certain conditions where this medication will not be given. So, is it okay if we have a chat? Yes, doctor. Then start taking history about that contraindication. And I told you, contraindication, which is this medication will be contraindicated in. So take history, relevant history. Guys, I said to you, if the patient is having high blood pressure, I said to you, number two, I said to you, if the patient is bleeding from anywhere, like what? Like peptic ulcer, any pain in your tummy, any ulcers in your tummy. So high blood pressure, peptic ulcer. Number three, if the patient is pregnant, so if she is a female, ask about pregnancy. Number four, liver and kidney problems. So 5 contraindication. Most of them to do with blood, bleeding, high blood pressure, peptic ulcer, pregnancy, kidney and liver problem, okay? So these are the contraindication for this medication. Now, what to watch out for? Because I said to you, this medication can lead to making the blood thin. So always tell her, some situations would like to talk to you about things that you should look out for. Number one, falls. Make sure you walk slowly so you don't trip and you don't have a fall. Number two, dark stool. Watch out for dark stool. Heavy periods. When you go to the dentist, make sure you tell them that you are on this medication while shaving, while dealing with sharp objects. So be careful while shaving, because again the blood is thin, and be careful when you are dealing with sharp objects, again because the blood is thin. So things to watch out for, again, falls. When you go to the dentist, let them know because of the bleeding. When you shave, while shaving, and watch out in case you have any dark stool or heavy period. Okay. When you tell the patient, this patient needs to be taken once daily, every day. So make sure you remember it. You remember taking the medication. Be careful, because if the patient said to you, Dr. Mo, what if I forget taking the medication? So in this case, number one, you need to make sure that she doesn't forget. How? You can say to her, can you set a reminder on your phone? Or so if the patient forgets, if she tells you, doctor, I forget things, I may forget taking the medication. So make sure that you should not forget taking this medication. So you can set a reminder on your phone. That's one option. Okay, well, you can give her another option of, for example, is there anything that you do on a daily basis in the evening? For example, do you watch regular show? Do you watch like something in the evening? If she said yes, you can say to her, you can put this medication next to whichever you do in the evening. For example, if she watch television in the evening, so put it next to the television, so you remember. So that's another way of telling her to remember. What if I forget it? If she forget taking the medication, if it's after 12 p.m., that's it. She should not take it. She should just wait for the next day. If it's before 12 p.m. and she remembers, she take the medication. Okay? So this is about the medication. So if she remembers, if it's 12 midnight, if she remembers before 12 midnight, she will take it. If she doesn't remember, or if she remembers after 12 midnight, then she can take the next day and she skip that dose. Okay? Okay, so this is warfarin. This is warfarin. And this is what you need to know about warfarin. And again, contraindication, pregnancy, liver, kidney. Don't forget high blood pressure, peptic ulcer, and when you talk about peptic ulcer, like tummy, pain in the tummy, and any bleeding source like that the patient is bleeding. And make sure that in this kind of cases, all the time, talk slowly, check the patient understanding, always make sure the patient understand. Should we move further? Are you following me? Because the patient is learning difficulty. Make sure you use the word thin and thick. Make sure you say some blood tests. But if the station is not learning difficulty, you will be quite faster. The station will be easier. Now, next station is about oxybutynin. 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 What is that? What is that? Oxybutynin. It is a station. It is a station where we're not really discussing about a medication itself. However, it's a medication side effect. Okay? So what is the station about? I will give you just the idea because it's a very easy station. It is about a patient who's coming with you, and he's complaining of memory problem. Doctor, I forget things. Doctor, my memory is not great. Doctor, I always don't remember things. Guys, always in the exam in Black 2, they can bring a station where the problem is medication side effect. What do you mean, Doctor, no medication side effect? So everything is negative. Apart from a patient is on medication, and this medication is causing something. What do you mean, Dr. Mo? I mean by that, a patient is having a complaint. When you take history, no. Apart from when you tell him, are you on any medication? He will say, yes, I am on medication. So once the patient says, yes, I'm on medication, explore what medication, for how long have you been using it, and always related to the condition. Has the problem started before or after using the medication? Because this is the clue. Has this problem started before using the medication or after using the medication? This is a new station about oxybutynin. Oxybutynin. The station is 75 years old patient presented to the GB clinic with memory problem. Memory problem. If a patient, old patient is coming and is having a memory problem, okay, what could be the causes? Could it be infection? Yes, maybe infection. Confusion. Yes. So then you will ask about any fever, any cough, any pain while passing urine. Why? To exclude sepsis or to exclude the cause of confusion. It could be sepsis. So any fever, cough, shortness of breath, pain while passing urine. That's sepsis. Yeah. Confusion. Could it be dementia? Yes. Any medical condition, any chronic condition. Have you been diagnosed with any condition that affect the memory like dementia? No, doctor. Could it be medication side effect? Yes, which is this station, the patient is on oxybutynin for urine incontinence. That's why he's having memory issue. So the station will start. I'm Dr. Fath Al-Bab, one of the doctors here. How can I help you? Doctor, I'm having memory issues, memory problem. Can you please tell me more about it? What do you mean by memory problem? Doctor, I keep forgetting things. Once the patient starts the station by I keep forgetting things, I'm having memory problem, so always assess the cognition. And do we know from psychiatry? We know from confusion stations. Any patient said I'm having memory problem, so do you know where you are? He will tell you yes. Do you know who brought you here? Yes. Can you confirm your full name and date of birth? Yes. The patient cognition, okay. Then you will start asking about the memory. How did it start? Since when? Is it increasing? Is it decreasing? By saying memory problem, what do you mean? He will say, doctor, I forget important events like my wife's birthday, like my daughter's birthday, like my anniversary. So that's what his problem is, forgetting main events. Then you will start asking him, have you had this before? No, doctor, I haven't had this before. Your differentials will be, I said 3 differentials. Sepsis and dementia and medication side effect. Sepsis. Any chest pain, shortness of breath? No. Feverish by any chance? No. Cough? No. Pain while passing urine? No. So there's no infection. Have you had any long-term condition that affect your memory like dementia? No, doctor. Gone. By any chance, are you on any medications? He will say, yes, I am. What medications are you on? He will say, I am on a medication called oxybutynin. So always explore. Why? Why are you using it for? Doctor, because I had urine incontinence. Is it controlling your condition? Yes, doctor. So, do you think that the memory issue has started before or after using the medication? So you need to know, because you cannot say medication side effect unless this problem happened after using the medication. Yes, doctor, he will say, no, it happened after using the medication, doctor. Okay, any allergy to anything, any family history of dementia. So I'm asking about NAF, medication, allergy, family history. No, doctor, no family of dementia. Thank you very much. Then ideally, I should assess I should do many mental state examination. Ideally, verbalize. You're not gonna do many mental state examination. So ideally, I should do the many mental state examination. But for the purpose of the station, I will move forward. Then go to provisional diagnosis. Say to the patient, well, from what you've told me, there is no source of infection that can lead to this problem. Well, the only thing I'm suspecting here is the fact that you are on medication, which could be the side effect of this medication. So is it all right if I open my book to check? Then in this station, you will open the BNF. What is the BNF, Dr. Mo? It's a medication book like back home. You know, back home, when we have a book for the medicine, you will open the BNF, open oxybutynin, and you will see that it's written on the side effects, memory problem. You will tell the patient, well, from what I can see here, that you have a medication that you are on is causing the problem. So what I'm going to do, I will talk to my senior, because we need to refer you to urologist. So we need to refer you to a specialist who will basically review your medication, prescribe you something else, as it's the reason why you are having this problem. Do you want to run any blood test? You can. You can do urine dipstick, you can do some blood test to excrete any infection, and that's the end of story. Okay? Okay, so this oxybutynin station is not written in the notes here, in the medication counseling notes, but you will find it in the new stations or the most recent stations, under the most recent stations. Now, I will be talking about contraceptions and emergency contraception. Okay? The station of emergency contraception talks about 14 years old, Nicole presented to the GP clinic requesting the morning after pill. You are an FY2 doctor in the clinic. Okay? Now, 14 years old coming for the emergency contraception or the morning after pill. This is the question. Okay. Again, a 14 years old or any girl under the age of 16, you need to ask about the age of the partner. Don't forget. Any girl under the age of 16 years old, you need to ask about the age of the partner. So, 13 to 16, you need to ask about the age of the partner. If the partner is from within the same age group, if the partner is 13 to 16, it's fine. The problem is, if she is between 13 and 16 and the partner is older, then it is a problem. You will inform social services. Again, at any stage, this scenario, talking about what? A patient, a female who's coming because she wants emergency contraception. She is 14. At any scenario, the female is less than 16 or a male less than 16 and there is a problem, always ask about the partner. If the partner is from the same age group, 13 to 16, it's fine. If the partner is from another age group over 16, you will inform social services. Anyway, this station, a patient is coming asking about that emergency pill or the emergency contraception. So, how can I help you? Or from the start, I'm Dr. Fatih Al-Bab, one of the general doctors here. Can you please confirm your full name and date of birth? She will confirm. How can I help you, doctor? I need the morning after pill. I need the emergency contraception. That's it. Definitely we can help you with that, but is it okay if we have a chat? Yes, doctor. Why are you asking for the emergency pill? She will tell you, doctor, because I had unprotected sex. Be careful, guys, because unprotected sex became as a presenting complaint. So she's coming here because she had unprotected sex. So that's the P1. P1 is unprotected sex. So now I would like to explore about it. So can you please tell me, when did you last have unprotected sex? When was the time before that? Dr. Mo, why did you ask about the time before the last time? Imagine if I had the last unprotected sex yesterday and the one before that 7 days ago. You cannot give me the pill Because the pill only, we will know later on that the pill only works within a window of 5 days. So ask about when did you have the last one? When did you have the one before that? Okay? Okay? And then you'll ask about, the age of the partner. The age of the partner. Okay? Can I please ask you some questions about your partner? Yes. How old is your partner? How did you meet him? Or how do you know him? Okay? Because we need to know, maybe he's her teacher, maybe he's her GP. So the age of the partner, how do you met, or how do you know him? If the same age group, it's fine. Now you will start telling her about, do you know what this pill is for? Yes, doctor, to prevent a pregnancy. Do you know what will happen if you don't take the pill? Yes, doctor, I will be pregnant. Why do I need to ask, do you know what is the pill for, and do you know what will happen if you don't take the pill? What we call it, it's assessing her mental capacity. What do you mean, Dr. Mo? Mental capacity is basically means nothing but she knows about the pill, she knows about the consequences of not having it, and she knows why she is taking it. If a patient is having mental capacity, she can decide for herself. She will take the pill as long as the partner is the same age group. I don't have to tell anyone. Okay? I don't have even to tell her parents. I don't have the right to even tell her parents. Okay? So now I will start telling her, well, definitely we can give you the pill. Definitely we can give you the pill. So I will start saying to her, would you like me to walk you through the pill? Yes. The emergency pill is a tablet that will be taken once. It's one tablet, once only. How does it work? It works by making the womb, the walls of your womb, of your uterus thin, so the egg doesn't get attached to the womb. It also works by making a mucus plug, okay, in the cervix, right? So mucus plug on the cervix and thin womb, okay, thin womb. So that's how does it work. So it works by making the wall of the womb thin, and it works by forming a mucus plug that prevent the sperm and the egg from meeting. Okay, so that's the how does it work. So I can even say to her, it prevent the ovary, or it delays the ovary. It delays or prevent the release of an egg of the ovary. That's how does it work, a mechanism of action. Okay, so now I will tell her there is two forms. This pill has two forms. One of them works within 5 days. And the other one works within 3 days. Levonorel, which is taken within 3 days, and Ela1, which is taken within 5 days of what? Of the unprotected sex. Okay? Now, side effect, like any pill, there are some side effects. Which is uncommon. Like what, doctor? You will feel sick. You feel that you want to vomit. Breast tenderness, dizziness. Again, you will feel sick. You will feel that you want to vomit. And when you say the word vomit, remember, I will tell you now. You will feel that you want to vomit. You will feel sick. You will feel dizzy. Breast tenderness. However, this pill, the earlier you take it, the better. What do you mean, Dr. Mo? So I highly advise that you will take it now in front of me with water. So the earlier, the better. So you should take it now with water in front of me. Okay? So if you do vomit within 2 hours, please come right back so I can give you another pill. Okay? So now this is the side effect. So the side effect, uncommon, one of them is vomiting. And once you mention the word vomiting, say to her, I will give it to you now. The earlier, the better. The earlier you take it, the better. So you will take it now with water. And if you do vomit, you can come right back. If you do vomit within 2 hours, we can give you another pill. Doctor, can I have two? I'm really sorry. We can only give you one. But if you do vomit, we'll give you another one. Contraindication. In brackets, I said history. History. In brackets. If you remember, I said contraindication, history. So for that, there are some situations where we cannot give the pill. So is it okay if I ask you some questions? Contraindication. Yes. Have you had the pill before? any allergy to anything. Have you had the pill before is a simple question. If she said yes, were you okay after? If she said yes, that's it. You don't need to ask about anything else. That means that there's no contraindication. So, have you had the pill before? Any allergy to anything? Any medical conditions at all, like liver problem, asthma, epilepsy. So medical conditions, liver problem, asthma, epilepsy. Liver problem, asthma, epilepsy. 3 conditions that you will ask about when you give someone the emergency contraception. What to watch out for? What to watch out for? That's very important, guys. Number 1, Nicole, this pill is not a form of long-term contraception. Do you know what I mean? No, doctor. So that means if you take this pill now, yes, it can prevent the previous unprotected sex. However, it does not prevent any future pregnancy. So if you go now and you have further unprotected sex, you can still get pregnant. You should tell her that. So number one, what to watch out for? What to watch out for? Number 1, it is not a long term of contraception. So if you take the pill and after that you have unprotected sex, so what's gonna happen? You can't get pregnant. So it does not prevent against future unprotected sex. Number 2, what to watch out for? This pill is not 100% efficient in preventing a pregnancy. So watch out for any pain, late period. Okay, that's one thing. So she can get pregnant. So watch out for late period. Number 3, you can tell her that if she continue to be sexually active in the future, we can have an appointment and advise you about using long-term contraception. So, because you know that she will leave now, she may have sex again and she may come again for emergency contraception. So always tell her, if you continue to be sexually active, we can discuss with you long-term contraception. That's point number 3 in what to watch out for. Point number 4, and very important point, this pill does not prevent you against sexually transmitted infection. The fact that you had unprotected sex, that put you at risk of having sexually transmitted infection. So I highly advise you, if you get some blood tests and some stress screening, okay? And I highly advise you to use some condoms, because it's the only way of preventing sexually transmitted infection, okay? That's it. Now she will tell you, doctor, would you tell my parent? Well, we wouldn't tell your parents. If you want to tell them, you can tell them, but we will not tell your parents. It's a question. You don't tell the parent, you cannot tell the parent, okay? So this is the emergency pill. So the emergency pill, I told you, 14 years old coming, asking for the emergency pill. I told you, number 1, she is 14. So you need to ask about the partner, the age of the partner, and how did she meet him. Coming to ask for what? For emergency contraception. Why? May I ask why you're asking for it? She will tell you, doctor, I need, because I had unprotected sex. So you're presenting complaint here, guys. Your P1 is unprotected sex. So make sure you ask about it. When was the last time? When was the time before that? And then you can ask her about, or when was the last time? 2 days ago. Was it the first time? Yes. So it's even a better way of asking. Was it the first time? Yes. Now you can assess her mental capacity by, do you know what is the pill for? Yes, doctor, to prevent the pregnancy. Do you know what will happen if you don't take it? Yes, doctor, I'll be pregnant. That's called assess mental capacity. If she has mental capacity, then you can say, definitely we can help you with that. And even if a patient is coming saying, doctor, how can I help you, doctor? I need the emergency pill. You can even have a better approach. Definitely we can help you with that. But is it okay if we can have a chat? So that will be even a better approach. Yes, doctor. Then you can say to her, why do you want it? She will say, because I had unprotected sex. That's your presenting complaint. So when was the last time? 2 days ago, doctor. Was it the first time? Yes, doctor. Can you please talk to me about your partner, his age, how did you meet him? And then you can go and say to her, well, the pill is, and start talking, tablet, only one time you will take it. It works by preventing or delaying the release of the egg. Preventing or delaying. Side effect, talk about all the side effects, and one of them is vomiting. So remember the word vomiting. If you vomit within 2 hours, you will have it again. And then you can say to her about the earlier the better. The earlier you take it, the better. And there is 2 forms. When you talk about the form, 2 forms. One works within 3 days. Okay. which is Livonel. One works within 5 days, which is Elawan. And then you can talk to her about the contraindication for that. I will take some history, then take history from her. And the history is, have you taken it before? Any allergy, medical condition like asthma, epilepsy, and liver problem. So asthma, epilepsy, liver problem. And finally, you will talk to her about what to watch out for, which we know, watch out for pregnancy, watch out for STI, watch out for if you're gonna be sexually active, or if you're gonna continue being sexually active, then you need to look for long-term contraception. Okay, so, and that's not a long-term form of prevention of pregnancy. So if you're thinking about it, so condom is the best way. Okay, so now the last but not the least, so it's a station for which a patient is coming to ask about method of contraception. That's it. So that's 25 years old coming to ask about long-term method of contraception. That's it. So long-term method of contraception. So the last station is a female coming to ask about long-term method of contraception. So by the way, we have devices and we have tablets. So this approach with this station, when a lady is coming to the clinic and she's asking to doctor, I need a form of contraception, the best way is, definitely we can help you with that. This is not emergency. This is long term. The other one was emergency. Definitely we can help you with that. Well, before we have a chat, is there anything in your mind? Is there anything in your mind that you want? Or I can say to her, well, we have two types of contraception. We have pills as well as devices. Would you like me to talk about something in particular? If she said, doctor, talk about the pills, doctor. Talk about the tablet form. I hate the devices, so only tablet. Well, doctor, talk about the devices, only devices. So please, I will divide the session into two. Tablets, devices. Why? Because if she's interested about tablets, only tablets. If she's interested about devices, only devices. And the approach will be, okay, anything in particular you would like me to talk about, or is there anything specific you would like me to talk about? She will tell you, pills, talk about pills. Device, talk about device. If she said nothing, start about the pill. Okay? So, hi, I'm Dr. Fatih Albab, one of the doctors here. Can you please confirm your full name and date of birth? She will do. How can I help you today? She will tell you, doctor, I really want a method of contraception. Definitely we can help you with that. The strongest question is, are you on any form of contraception at the moment? So at the moment, are you using any form of contraception? She will say, yes, doctor, I was. May I ask what? What were you using? So the strongest question here, have you been on any form of contraception? Yes, doctor, I was using that condom. So is there any reason why? Is there any reason why you don't want to continue on it? Well, doctor, yes, because, she will say, because I'd like to change it because last time I was on it, it was torn and I got pregnant. Well, definitely we can help you. There is form of tablets and there is devices. What would you like me to talk about? She will say, doctor, any. Now, start about the tablet. We'll start talking about the tablet. So, before we have a chat, are you sexually active? Do you have a stable partner? And then you will say to her, are you on any medications by any chance? 3-4 questions. Do you have any medical conditions? No, doctor. Then I've asked her a quick. Are you sexually active? Do you have a stable partner? And do you have any medical conditions? Are you on any medications? That's it. Now we'll start talking about the first tablet, which is COCP. Now, POP, progesterone only pill. So the first one will be combined oral contraceptive pill, COCP. And when I mean combined, I mean estrogen and progesterone. The second one will be POP, progesterone only pill. So only progesterone. By the way, the first one I will discuss, COCP, it has progesterone and estrogen and progesterone. And the component, the estrogen component, is the one that causes troubles. Like PE, chest pain, shortness of breath, pulmonary embolism. But the progesterone doesn't cause trouble. So the second one will be progesterone only pill, which means only progesterone, which means it does not have the same side effect. So I will start saying to her, well, the first one is combined oral contraceptive pill. Follow the structure. Follow the structure because it's a pill. It is in the form of tablets. The dose, you take it once daily. Mechanism of action, how does it work? You will tell her it contains estrogen as well as progesterone. Okay, so it contains estrogen as well as progesterone, and it prevents your pregnancy. Side effect, what to watch out for, and the contraindication. You will say to her, for that, is it okay if we have a chat? Yeah, so what are the contraindication for combined oral contraceptive pill? Number 1, any chest pain, shortness of breath? No. Have you had any pulmonary embolism before, blood clot in your heart or lung? No. Are you on any blood thinners because it's contraindicated? No. Any bleeding disorder? No. What about the relative? Any of your relative had blood clot in the heart or lung? No. Any liver condition? No. Migraine? No. Do you smoke? And then if yes, take history. So basically the contraindication for the combined oral contraceptive pill: number 1, blood clot in the heart or lung. Number 2, blood thinners, the fact if the patient is a blood thinner. 3, bleeding disorder. 4, family history of blood clot in the heart or lung. 5, migraine. Cancer, breast cancer, smoking, liver disease, okay? Migraine, breast cancer, smoking, liver disease. And I told you the problem is because of the estrogen component, not the progesterone. The second pill, if she has any of these positive, she cannot be on combined oral contraceptive pill. The second one is, and what is the efficacy? How efficient it is? Guys, none of them is 100%. All of them 98, 99, okay? None of them prevent against STI except for condoms, okay? So the second one is progesterone only pill. Again, it is in the form of tablet, dose once daily. Mechanism of action, how does it work? It has only progesterone, that's it. So it has only progesterone, and the progesterone work by working on 3 points. What do you mean 3 points? It works on the ovary as well as the uterus as well as the cervix. So the progesterone work on the ovary, uterus, cervix. Ovary, prevent or delay the release of an egg. Uterus, make the uterine wall thin so the fertilized egg cannot attach. Cervix, it forms a thick mucus plug where the sperm cannot reach the egg. So this is the mechanism of action. How does it prevent? It works on 3 places: ovary, uterus, cervix. Now I will say to her, it has some side effects. Like what? Like bleeding, irregular period, breast tenderness. Again, it has some side effects like bleeding, irregular periods, and breast tenderness. However, the fact that it does not have estrogen component, so it does not cause any blood clots. So the side effect: irregular period, breast tenderness, bleeding in between period, and headaches and mood swinging, okay? Again, the efficacy, 99%. Okay, now the implant or the device. We have 3. We have implant, one that they put on the arm. We have intrauterine device, which is copper, which is only mechanical prevention, the fact that there is an IUD there. And we have Mirena coil, which is mechanical plus hormone. So again, the device is 3. We have an implant in the upper arm. We have IUD, which is mechanical, which the fact that there is device there, it prevents the ovum, the egg and the sperm from meeting. And we have the third one is Mirena coil, which is basically mechanical and hormonal. That's it. These are the 3. So you need to understand them. The implant in the arm secretes progesterone. Where? In the blood. Secretes progesterone in the blood. So it works by the same mechanism as the progesterone only pill. So it works by what? Secreting progesterone in the blood. So it makes, number 1, mucus plug in the cervix. Number 2, thin uterine wall. Number 3, prevent or delay the release of an egg. But also, because it's in the blood, like the tablets, it causes mood swings, it causes irregular period, it causes weight gain, it causes headaches, systemic causes. But what is the advantage of this implant over the tablet? You don't need to remember it. That's it. You don't need to remember it. So the implant, is basically small flexible tube that will be under the skin of the upper arm. Okay? 99% effective. Alright? How does it work, doctor? So again, the 4 flexible tube under the skin of the upper arm. Those, you put it there, it's not daily tablets. How does it work? In brackets, progesterone. How does it work? It works like the progesterone pill. How, doctor? Number 1, it works on the ovary by delaying or preventing the release of an egg. Number 2, on the uterine wall, making the uterine wall thin. Number 3, mucus plug, and also has systemic effects. Side effects, same, irregular period, mood swings, headaches. All right. So what is the only advantage over the pill? That you don't need to remember it. You don't need to remember it. You don't need to remember it. Okay. Now the intrauterine device. The intrauterine device, again, do you need to remember it? No. But what is the form of it? The form, plastic or copper device. So plastic or copper device, the form, where it's inserted in the uterus. How does it work? Mechanical barrier, something on the way. So it prevents the egg and the sperm from meeting. So it works by mechanical barrier. So prevention of the egg and the sperm from meeting. Okay? So now, advantage, you don't need to remember it. It lasts for 5 years. Disadvantage, we know disadvantage. We know ectopic pregnancy, PID. So disadvantage, ectopic pregnancy, PID. Don't forget. You remember when we were talking about PID, we said one of the risk factor, IUD. When we were talking about ectopic risk factor, IUD. So at disadvantage, ectopic pregnancy, which is pregnancy outside the womb, as well as inflammation of the uterus, pelvic inflammatory infection. Finally is the IUS. I said IUS, what we call it Marina coil. What is that? It is exactly like the IUD. Okay? But secretes hormone. So mechanical and hormonal. So the fact that it is in the uterus, mechanical device in the uterus, but also secretes progesterone. So hormonal. However, the advantage of secreting hormones, it is local. It does not cause the systemic side effect because it's in the uterus. So it secretes progesterone in the uterus. So it causes only localized effect. So I will tell here, the Marina coil, it's a device releasing hormone. So it works by, so the form device, plastic device that contains progesterone. Those, again, it works for years, 5 years. But how? What is the mechanism of action? I will say to her, it has 2 mechanisms of action. It has the mechanism of action of mechanical prevention of the sperm and the ovum from meeting, mechanical, as well as the fact that it is secreting, this is secreting progesterone. So it works by localized the effect of the progesterone in the uterus. Like what, doctor? Like, again, 3 points. Prevent or delay the release of an egg, thin uterine wall, mucus plug. Okay? And again, you don't need to remember it. This is the advantage. And it's for 5 years. So you don't need to remember it. And it's for 5 years. And even the advantage doesn't cause systemic side effects. Okay? Finally, female fertilization. It is a permanent method by basically blocking the part of uterine tube, of fallopian tube. So we block the part the part of the tube, we block it, we close the tube, the fallopian tube. 99% effective, but the only thing that difficult to reverse and the NHS doesn't fund it. So difficult to reverse and the NHS doesn't fund it, and I highly advise finally you tell her the condom, because it's the only method of preventing the female against STI. Okay? Okay. Now let me tell you something, that when we spoke about combined oral contraceptive pill. It has estrogen and progesterone. The side effect comes, the problems comes from where? From the estrogen. Blood clot, heart and lung, PE, family history of blood clot, smoking, breast cancer, and migraine, liver problem. The second one is progesterone only pill. Again, no estrogen here, just the progesterone. So it does not cause the problem that the estrogen causes, like blood clot, but it causes what? Headaches, irritability, and bleeding, heavy period, bleeding in between. Both you need to remember, tablets. Now we have 3 devices. We have the implant in the upper arm. Again, how does it work? Remember, the implant and the Mirena, they both secrete estrogen. However, the implant estrogen systemic, so it works the same effect of estrogen tablet on the ovary, on the uterus, on the cervix. Okay, it has the same side effect, but you don't need to remember it. So the only advantage that you don't need to remember, because it's a device. IUD is basically implant, so mechanical prevention. Any hormones? No. Mechanical prevention. Mechanical prevention. Be careful, because it can lead to ectopic and pelvic inflammatory infection. Finally is the IUS, which is mix of hormones and mechanical. But the hormones is good. Why? Because it's localized. It works on the uterus. So it does not cause the systemic effect. Okay? That's it. As simple as that. Alright? And be careful that the start of this station is pills and devices. Which one would you like more to discuss? Pills, talk about pill. Device, talk about device. And always talk slowly, check understanding, assess knowledge, move further. Alright? Thank you very much. Thank you.